decades, Dr. Grünebaum has held numerous leadership positions, including Director of Obstetrics and Chief of Labor and Delivery at Weill Medical College of Cornell University. His contributions to obstetric patient safety and quality improvement have significantly influenced the field, shaping protocols and enhancing maternal and fetal outcomes. Dr. Grünebaum is widely published with an extensive portfolio of peer-reviewed research on maternal fetal medicine, obstetric safety, and the integration of innovative technologies in obstetrics. His expertise is particularly relevant today as we explore the transformative role of AI in obstetrics. AI is revolutionizing prenatal care, labor management, and risk assessment. And Dr. Grünebaum's insights, just as he shared with us earlier, and I'm looking forward to the hour, will provide us with a forward-thinking perspective on how AI can enhance clinical decision-making and diagnostic accuracy. Please join me in welcoming Dr. Amos Grünebaum. Thank you.
Thank you very much for giving me this really nice introduction. And I'm going to talk to you today about artificial intelligence, a rapidly evolving dimension of perinatology. And this is the part one, introduction to artificial intelligence and generative artificial intelligence. And there's going to be part two if I get through part one. Disclosure, no relevant financial or non-financial relationship. This presentation was developed using a hybrid approach, incorporating generative artificial intelligence tools to enhance organization and content, while all clinical interpretations, conclusions, and decisions remain solely the responsibility of myself. I have a request to the audience. Please submit your questions in the chat during my talk so I can engage with the audience, and I will do my best to answer them during or after the presentation. So I need somebody to interrupt me and tell me that there's a question. Do not be afraid of AI. Many of us are afraid of AI, but don't be afraid. AI and machine learning won't replace healthcare professionals. They will empower those who embrace them to deliver smarter, more effective patient care. And going directly to the first case that you presented this morning, I went to AI while you talked, and I said, create a checklist for a patient to sign for trial of labor. And this is what AI came up with. And this is what was created within, 2 seconds. Obviously, you wouldn't use just AI, but it helps you when talking to patients. This was created by Claude AI. And the same case, the patient refused a cesarean, create a checklist for a huddle when the patient refuses a recommended cesarean delivery. And this was created, and I created this within 2 minutes. Cesarean delivery refusal, clinical team huddle checklist to talk through and to talk about everything, because several of the questions that came up, did you talk to her about this? Did you talk to her about this? AI will help you with this, definitely. There has been an incredible growth of valuation of companies associated with AI. For those of you who know a little bit about the stock market, on the right side, there are several stocks, what happened to them over the last couple of years. Skyrocketing values, OpenAI, Anthropic, multi-billion-dollar companies. And clearly, people see something in AI that we in medicine have not completely seen yet. So where is your time better spent? If you have 30 minutes a day, would you like to spend it more on Twitter, on TikTok, on Facebook, on Instagram, or on generative AI? And for the last year, I've taken myself off Facebook. I've taken myself off X, never been on TikTok and Instagram, and I use generative AI to learn and to read. These are just some of the AI, the biggest AI places that I go to. I would recommend you use more than one. The one I personally like is called Perplexity. It's this one. This is the logo for ChatGPT, Mistral, Claude, and Gemini are all major sites where you can use AI. So what's the difference between traditional AI and generative AI? Traditional AI focus on analyzing and making decisions based on existing data. Generative AI creates new content or data based on pattern learns from existing data, capable of producing text. So what we're going to talk about today is mostly generative AI, and specifically large language models, which are a subset of generative artificial intelligence that uses machine learning to analyze and understand text. It's trained on large amount of data, such as books and articles, to learn how language works. It's essentially no different than what we do. We are trained on large amount of data, such as books and articles, except I'm going to show you soon that they can learn and they can read much more than we do. The key capabilities of large language models: natural language understanding, text generation, translation, summarization, question answering, context, all of these things large language models can do. And these are just some of the companies that you can access today. OpenAI, ChatGPT is the #1, but Gemini, Anthropic, Claude, all of these are well behind, and some of those have some stronger ways to do things than others. So I try all of them at different times to do what I need to do. I've published on it. Thank you so much for introducing me with publications. I strongly recommend people to publish. It's one of the things that keeps your brain alive if you publish. Please do that. And these are just 3 of my publications related to artificial intelligence. We were the first, Dr. Shervanek and myself, to publish on ChatGPT in OBGYN. We believe that ChatGPT has the potential to be valuable to users. And this was 2 years ago. It's amazing in 2 years how much it has changed. This is our most recent publication, Enhancing Patient Understanding in Obstetrics, the role of generative AI in simplifying informed consent for labor induction with oxytocin. You talked about, during your presentation, was the patient informed about this? Did she give informed consent? This is how AI can help you. The top key capabilities are development and updating of obstetrics and perinatal care protocols. I remember for the longest time we spent months and months to develop a protocol. Today, you can develop a protocol in an hour or less. High-risk pregnancy management support, maternal health risk assessment, evidence-based guidelines, all of these things you can use large language models to update yourself and to help you do your work. And as you can hear, I don't have a speech disorder. I have an accent. It's a German accent. And one of the things that I was trained to do is to be efficient. The more efficient you are, the more you can do, and the more you can spend time on doing other things. So here's AI versus doctors. AI processes millions to billions of articles. We read 250 to 300 articles per year, if that. It reads in milliseconds. We take 30 to 60 minutes per article. AI instant recall, we have limited recall. My brain is actually getting worse as I get older. Synthesizes and summarizes instantly, requires years to absorb, and AI never fatigues, and fatigue, obviously, with us comes into place. The New England Journal of Medicine has a specific journal called AI, and it strongly supports AI. So these days, when a couple of years ago, journals did not support it, today it's more and more supported. You go to the internet and you see how people got helped by AI. A boy saw 17 doctors. ChatGPT found the diagnosis. And this may sound to you dramatic, but in my experience, as a physician, as a maternal fetal medicine, I can tell you that these things do happen on a regular basis. ChatGPT diagnoses chronic pain, paging Dr. ChatGPT. you can see more and more that people and doctors go to ChatGPT and find things that they didn't find before. ChatGPT, and then there are now dozens and dozens of peer-reviewed publications. ChatGPT performs surprisingly well in solving complex case challenges, high reproducibility, and society is expected to increasingly rely on AI as a tool to support the decision-making process. This is a research letter from last year. In JAMA, large language models was better than physicians in processing medical data. Large language models will more likely augment, not replace, the human reasoning process. Identification of human-generated versus AI-generated research abstracts. When they compared human versus AI-generated abstracts, experienced physicians thought the AI-generated abstracts were better. This study highlights the difficulty healthcare professionals face in distinguishing between human-generated and AI-generated research abstracts. These days, you cannot distinguish anymore, even with the best tools, if something created by AI was created by AI instead of humans. So how can it help with inefficiencies in doctor-patient's relationship? We repeat the same explanations again and again and again. AI-generated summaries and chatbots can provide good explanations. We manage patient misinformation. It can flag misinformation, offer trusted, evidence-based answers. Handling unnecessary or excessive questions, something that many doctors have to deal with. AI-powered FAQs and virtual assistants can handle these questions. Lab results, simplify lab results. I use AI to interpret lab results. Lack of personalized educational resources. What's amazing with AI, and there are studies on this may sound to you a little bit strange, but it's true. AI can show more empathy than many doctors do. AI can teach you empathy and addressing unrealistic birth plan expectation. Who has not had a patient who came in to labor and delivery with a birth plan and then you had to deal with this? I think it happened to all of us. So let me show you an example of what to do with this. This is also a birth plan a patient came in with, a handwritten birth plan. How do you deal with a handwritten birth plan? Anybody, any question, any ideas? No? So what you do is you take it, usually before AI, you read it carefully, you acknowledge and appreciate the patient's effort, you discuss it. It takes you 1 to 2 hours to address a birth plan. With AI, you have AI read and translate the birth plan. I'll show an example. You take the handwritten birth plan. You take an image with your iPhone on it. You place it into AI, and I'll show you what to do. You use it to summarize it. You use it to generate clarification, assist in explaining. Total time spent 10 to 15 minutes. So you attach the birth plan to GAI prompt, and you say convert to text. Convert to text, a simple prompt. And this is what AI did. It converted the handwritten birth plan into text. Very straightforward, no mistakes made. Then the next step is you say, as a doctor, respond to each point with your best suggestion. And this is what GA came up with. Most hospitals allow, the patient asked for doula and husband in womb. Most hospitals allow both a doula and partner present. She said no Pitocin. This is your answer. Pitocin is typically administered to induce labor and delivery. If labor progresses naturally and without complication, we can accommodate you. However, if labor stalls or there are concerns, the medical team may recommend Pitocin for safety reasons. This is directly coming from AI. No rupture of membranes. artificial rupture is sometimes performed if labor is progressing normally. So it goes on and on. No IV fluids, no epidural policy. This request is fully within patient rights. Medical team will support. No episiotomy. Episiotomies are not routinely performed. You cannot say we never perform it. We don't routinely perform it anymore. But there are indications, and obviously patients have to give informed consent. No antibiotics to baby. Please use soap. Do no hot sanitizer, etc., etc. This is all what GAI came up with in a second. Delayed cord clamping, general approach, no head on the baby. It's important to have a discussion with the care team. In about 3 seconds, GAI produced this based on the single handwritten birth plan. You can use it for patient education. ChatGPT can generate personalized educational handouts specifically to the patient. You have a 43-year-old patient who has her first pregnancy with IVF. You put this information in and you ask, and we'll talk about this in a second, how prompts work. So how do you best use it? You use it as a hybrid partnership between yourself and I. You automate routine information, you enhance decision-making, you streamline documentation, you personalize patient education, and you support, not replace yourself. AI should complement clinical expertise, ensuring ethical, evidence-based care. Doctors often use GAI incorrectly. Doctors often use GAI incorrectly. Many physicians lack adequate training in prompt engineering and conversational design, preventing them from effectively guiding AI systems. You need to be able to talk to ChatGPT, and then ChatGPT will be able to talk back to you. If you don't speak effectively ChatGPT's or the other AI's language, it will not be able to talk to you back. Doctors often struggle with integration challenges. I remember well before the vast majority of you were born, in exactly the year. In 1981, I became chief resident at Kings County Hospital. We had a $10,000 machine delivered to us. It was called an ultrasound. And it ended up in the equipment room for about a year because nobody knew how to deal with this. This is the same thing that happens with AI today. It's available, you can use it, but nobody really knows how to use it well. Medical professionals frequently have unrealistic expectations about the capability and limitations, either over-relying for clinical decisions or dismissing potential valuable AI insights. So, the present and the future of obstetrics, from ultrasound to AI, technology has never replaced obstetricians. It has empowered us to provide safer, more precise care for mothers and babies. So what you need to do, you need to start getting trained in AI. Medical education must be restructured to include foundational AI literacy, covering basic, it's like learning a new language. Residency programs should incorporate hands-on training with AI. For example, one recommendation I have, during your grand rounds, somebody did what I did. When you have a question coming up, ask AI and show it up on the screen, instead of 5 different people providing you their own personal experiences, which I'm sorry to say are not worth as much as AI can help you with. Personal experiences are important, no question about it. But sometimes, specifically, I'm talking about mine, they may not provide you with the right information. Continuing medical education should regularly update practicing obstetricians with evolving capabilities, emerging research. Physicians need training in effectively communicating AI-derived recommendations, and training should emphasize prompt engineering. Most of you have never heard the word before, and if this is the first time, hopefully you will take those two words home with you: prompt engineering and critical evaluation of AI outputs. The hybrid approach to AI, it should be a partnership combining human judgment with AI capabilities, complementary strength, shared responsibility, adaptive workflow, and continuous improvement. You continuously need to improve it. This is a great graph. By the way, this graph was created by AI. Probably you have to define the problem, you have to integrate the data, AI data processing, analysis, review, refinement, iterative learning, and you continue with program definition. This is a continuous cycle where human judgment and AI capabilities enhance each other at every stage. And that brings me to part 2. I think we still have enough time to go to part 2. I wasn't quite clear how long it would take me to go through part 1. Are there any questions so far about this part? Yes. Dr. Bergman, how are you?
I'm very, very good. And what I would like to ask, this is obviously such an important topic. To maintain our medical licensure, we need to do CME, etc. Should this be required for all clinicians to go through a course on AI? Because what you're describing, that we're not practicing adequately if we're not using this modality.
You're absolutely right.
And it should be mandatory rather than voluntary. But I'd like your opinion on that.
You are absolutely right, and that is why part 2 comes in.
Oh, okay.
That's where I will teach you a little bit about. I gave you the introduction, and hopefully I provided you with some taste of what's down the road. And the second step is the second part is the advanced medical education.
Mm-hmm.
Thank you.
It should be mandatory. That's what I think.
A lot of, yes, correct. But we have already so many mandatory things to do. I think that as far as I'm concerned, some of the mandatory things that I do are not fun for me personally, but this is fun for me. This excites me because I learn every single moment about this. And when I introduce people who are not in medicine, but they're in other specialties, they get very excited about it. Thank you. Any other questions? So, key non-medical roles every obstetrician must master: communication and patient educator, risk management, team leader, hospital administrator, educator, mentor. We have a lot of hats on. Prompt engineering in healthcare. What's the most effective way to structure AI prompts for different diagnoses in obstetrics should be among the things we need to learn. A publication this week in JAMA was called Advocating exactly what Dr. Bergman just mentioned, advocating for a Master of Digital Health degree. There's an urgent need for professionals who are proficient in digital health. The MDH, Master of Digital Health, represents a timely and strategic solution, and you don't have to have a master in digital health necessarily, but you can learn it on a regular basis. Instead, again, I'm not talking to you directly, and maybe I do. Get off Facebook, get off TikTok. Mr. Zuckerberg, one of the richest persons on earth, makes money off you. Why do you want to support him? What is a prompt? A prompt is a specific instruction or question you provide to the AI to guide its response. The quality of the prompt directly influences the relevancy and accuracy of AI's output. Learn about what a prompt is. Doctors should develop and save efficiently AI prompt. I'll show you in a second how to do this, as they can significantly streamline routine tasks, enhance patient education, and improve clinical decision. So when you create something that you feel is efficient, and share them with others, be generous. This is what a prompt looks like, not filled in different AI models. Claude, ChatGPT, Gemini, Deep Research shows you how a prompt looks like. All you get a blank. And then you enter your information in there. This is ChatGPT. Explain to an obstetrician what prompt engineering is in 2 to 3 short sentences. I let ChatGPT answer it for you. Prompt engineering is the practice of crafting precise and structured input to optimize responses from AI models. I let Gemini answer that same question. Prompt engineering involves strategically designed input questions or instructions to get the most accurate and relevant responses from the AI. Claude explained to an obstetrician what prompt engineering is. Prompt engineering is the art of crafting effective instructions for AI systems to produce their desired output. And perplexity. Prompt engineering and perplexity, as far as I'm concerned these days, should be your go-to AI system. At least you should use it together with others, because it gives you, see those numbers here? It gives you references. So you don't believe just the AI, it leads you somewhere else. Prompt engineering is the process of crafting precise and optimized instructions. Steps involved: step 1, define the task, identify inputs, craft detailed prompts, and refine your prompts. The refining your prompts is among the most important things. With AI, with the systems that they work today, they like you to tell them, who are you? They like you to tell them what it's for. And they also like to interact with you. So when you give one answer, you go back to your previous question and continue with this. So prompts for counseling a cesarean refusal. Create a comprehensive patient-structured counseling platform. This is a prompt. This is not the answer itself. This is just the prompt. You copy-paste it. You ask the AI for a structured assessment, evidence-based approaches, specific language, alternative options. This is what you ask, and then it will give you the answer. Important prompts in healthcare: improves efficiency, enhances decision support, facilitates research, education, and public health initiatives. So here are 10 tips for using prompts in healthcare. Be as specific as possible. Describe your setting. Start off with saying who you are. I am an OBGYN doctor. I am an MFM doctor. I'm here with a patient who's 43 years old, XYZ. Describe your setting. Experiment with different prompt starts. Summarize is a great word to use with AI. Explain is a great word to start off. For example, you can download a PDF or 2 PDFs or 3 PDFs of peer-reviewed papers, and then you say summarize them in 2 to 3 sentences. Just do that. Simple stuff, very simple. It will do it for you. Identify your overall goal. Ask AI to play a role. Play to be a midwife. Play to be a, here's my favorite one. Ask ChatGPT, play to be a malpractice lawyer. I just had a patient with ruptured uterus who was on misoprostol. Play a malpractice lawyer and tell me what happened. Iterate and refine. Use threads and refer to prior ones. Ask open-ended questions. Request examples. Provide an example is one prompt. And use time wisely. Common tasks with GI prompt. Outline key points for upcoming lecture. Draft an abstract for research. Prepare agenda for perinatal mobility. Summarize recent advancements. Every single grand round case presentation, every single grand rounds case presentation, go to AI and spend 10 minutes on preparing with AI for your case presentation. Create a mentorship plan, design quality improvement initiatives, develop patient education, and it does many, many more things. I traveled a couple of months ago to 2 countries, several countries, whose language I didn't speak. Happens, right? So I went to restaurants, and not expensive ones, by the way, and they had the food, obviously not on paper, but they had it on blackboards written in their own language. So how do you know what you're going to order? You take a picture of that blackboard and you tell AI to translate it into English. You take a picture of the language and it translates it for you. It works in many languages, hundreds of languages. So this is what I did. Create a bar showing survival. You have a patient who's at 23 weeks. She wants to know what's the chance of my baby surviving. At how many weeks? This is what ChatGPT created in 2 seconds. And then you ask, list the same by week graph, but include major complication. And it will include it with major complications. And then you don't have to believe, obviously, AI. You then ask in Vancouver format, which is the format for publications, show me the publications this was based on. And it gives you the publications it was based on. You can then go on and say, summarize each of these publications for me, and it will do it. A pre-delivery checklist when you do a huddle. I'm very strongly, we doing simulations for shoulder dystocia preparation and prevention of Erb's palsy. You need a checklist when you do a huddle prior to a patient who is at risk for shoulder dystocia. Risk factor review, teamwork. I love to do checklists, and it creates it for you. This is a great checklist to do with your team prior to shoulder dystocia, and it creates it for you on many different levels. I have a mini checklist. One checklist is a checklist for prior to cesarean delivery in a patient with an impacted fetal head who has been pushing for 5 hours. You need a checklist for this. And then develop a library of prompts. Create an effective prompt. By curating a library of well-crafted prompts, healthcare professionals can consistently access tailored, up-to-date information in generative customized content. These are some examples of prompts. Hysterectomy, a patient with placenta accreta with hysterectomy refusal. Develop a comprehensive clinical and ethical approach for managing a patient with confirmed placenta accreta who refuses C-section. You don't have to use your brain. You can use your brain. You should use your brain, but let AI help you in a hybrid approach. Impacted fetal head. Publication search. Please show me XYZ recent publications about this issue, including high-quality studies from the past whatever years with complete citations that I can easily access. Ask the AI to only show you complete DOIs and Vancouver forward, because one thing I didn't tell you and where you need to be careful of, some AI systems make up citations. So don't believe all citations until you confirm them, and ask for the DOI, because the DOI will link directly from the AI to the citation. Verify them, prioritize academic journals, all of these things. This is, by the way, a prompt for a publication search. Can you help create a patient-friendly information sheet on yeast, vaginal yeast, that includes its causes, symptoms management? It will do it for you. You can also ask the system to do it on one page. It will do it for you. You can ask it to write it in Chinese, in English, in Spanish. Can you provide the latest evidence-based guidelines for managing high-risk pregnancies? That's a little bit too general. You want to be more specific. What are the possible differential diagnoses for cervix of 1.5 centimeter at 17 weeks of pregnancy? And what management surgeries could be considered to prevent preterm birth? And then you ask it to give you citations. How should I counsel a pregnant woman about the risks and benefits of endocentesis with non-invasive prenatal testing? What are the current best practices for preventing and managing postpartum hemorrhage in both vaginal and cesarean deliveries? It helps you create a PowerPoint slide. Create a 7-slide PowerPoint presentation on the diagnosis and treatment of short cervix. It does it for you. As long as you tell whoever you present it to that you use their help, and as long as you go through each slide and make sure it is what you support, it's okay. Saving effective prompts can be highly effective for several: consistency, efficiency, optimization. By systematically saving and reusing your best prompts, you can enhance your overall experience. So where do you save your prompts? I use Apple Notes. Apple Notes is, as far as they're better. If you are in the Apple system, I think it's a pretty good one. There are other ones you can get and download from the internet, but all of them require some learning. Even today, my Apple Notes are not, I haven't learned all of how strong it is. Document storage systems, you can use Google Docs, you can do task management tools, bookmarking service, plain text files. There are different ways, whichever works best for you. I use Apple Notes because it is available on my laptop, on my desktop, and it's available on my iPhone. Same thing. When I save a note on my iPhone, it's available immediately on my laptop. Categorize it. One of the important things. Be organized. Context your notes. You can do hashtags. Hashtags are wonderful in Apple Notes. Inside your note, use a hashtag, and then you create a folder based on that hashtag. So when you open up the interactive folder, it finds the notes with those hashtags. Familiarize yourself with available tools. And here's an important thing. Upgrade yourself to the pro version of any of the AI systems. They're $20 a month. ChatGPT, upgrade to ChatGPT 4.0. If you use Perplexity, if you use Claude, it's $20 a month. Trust me, it's probably your best spent. My daughter tells me that drinks where she goes to cost $20 a drink, and it's well spent. Collaborate with colleagues and share best practices. Stay updated on AI advancements. 12, effective. More on prompt. What are the latest ACOG guidelines for managing preeclampsia with severe features? But better is to create your case and tell them about the case. Validation. Needed AI outputs require human validation. I think I talked enough about this. Quality assurance, contextual refinements, bias identification. Human oversight catches subtle biases. But believe it or not, AI these days is less biased than we are. All of us, I'm sorry to say it, Dr. Beckman knows that I talked to her about this. We are very much biased. And it's amazing when somebody asks you a question that you never expected how biased we are. So if somebody says AI is biased, we are biased too. Here's a concise prompt for reviewing a relevant scientific paper. This is a whole prompt. Keep it, save it, provide a brief recap of the attached PDF, focus on the main research study. Key findings do not include analysis, limitations, implications. Just summarize. Remember, we use the word summarize. Summarize what the paper investigated, and you'll find amazing stuff. And I think we're done. Thank you.
Thank you so much, Dr. Grünebaum. Thank you. Are there any questions? So when you are using AI, what percentage of the time are you just on your phone? And what percentage of the time are you on a larger screen, like a laptop or an office computer?
Now you see me.
Yes.
Hi. I work a lot from home, and my job is to do research and to publish and to write publications. And I continuously use AI, different kinds of AI, not the same one, to do my research, to write, to help me with references. It's really important. It's amazing. You can, it's amazing what AI can help. But I'm the one to write the paper very clearly, but I use it as a tool, the same way you would use ultrasound as a tool. When you work in the ultrasound department, you know, you are with your ultrasound machine all the time, but your brain is the one that does a lot of the work. Yes, Dr. Backman.
This was really informative and I learned so much, but it was really based on what each one of us as an individual can do. Do you know if there's anything being done in medical systems? For instance, most of us on this in this meeting are with Robert Wood Johnson Barnabas Health. Are medical centers incorporating AI into their established healthcare centers, or is this more on an individual basis? Where Gloria
That's a great question. Great question. In my experience, doctors and medical systems lag behind many things by years and years to come. And it's an issue of money invested. You need to invest money into it. And let me start with a rant about electronic medical records. We all are forced to use electronic medical records. And when I was in charge of a huge labor and delivery floor, and I introduced it 20 years ago, electronic medical records. We were the second department to use electronic medical records. Most of you do not realize that the basis of our electronic medical records is word processing. It's not AI, it's not intelligence. We wish it would be intelligence, but it's word processing. So they are well behind AI. And AI literally exploded about 2 years ago. So it's going to take a long time. In the meantime, you need to do what you should be doing and use it in your best possible way. Eventually, what will happen is, and there are already many, many studies out there that summarize your medical records for the patient. There are many publications on translating your medical records not into a different, into a different language, but into a language that your patient understands. We allow our patients to access their own medical records, correct?
Yes.
They don't understand it. But there is a way to translate your electronic medical records into what I call plain language. Plain language is something that the majority of people understand. And I just read a paper on pathology reports, probably among the most medical complex reports, to translate into plain English. And they did a study where patients understood it more. So yes, there are many different levels. But at the end, when I started about electronic medical records, why don't you guess how much time your nurse spends on labor and delivery on an electronic medical records, inputting data? How much time does she spend, do you think, percentage-wise?
90%.
Correct. So probably closer to 70, but yes. And it's horrible. It's just horrible that we have to spend so much time on documenting something that at the end is probably the most inefficient thing ever done. When I started electronic medical records, the nurse put in some information, and our record didn't allow the doctor to read the nurse's note because there were two separate systems. We have Dr. Eugenia there. Gerda, I'm sorry, I'm using their
Yes.
first name.
She has written a question in the chat. Oh, no, now she's raised her hand. You want to speak, Dr. Gerda?
Yes, thank you so much. This is such a great lecture, and I think it's in general it's been very much looked down upon, the use of AI, and I think it does need to be revolutionized, that this is assisting us, not replacing us. As the GYN oncologist, we have patients coming in, for second, third opinions, and it sometimes takes me over 30 minutes to kind of review their records and summarize the treatment course. So it would be great if, like Dr. Bachman said, these systems could be incorporated in our medical records and assist us. I was just wondering, for a bigger picture, there's a lot of fear in general public about, future AIs replacing some of the specialists like radiology, pathology. What are your thoughts on those fears?
So I went to my dentist yesterday. And dentists do x-rays, right? And there was something wrong with my tooth. And she took a picture of it. And she showed it to me, the actual picture. I took an image of that tooth with my camera. I inputted the image of the X-ray. You see the X-ray?
Yes.
Into AI. And I said to AI, what do you see? And I showed it to my dentist, and my dentist nearly died. It saw more than she saw, and it gave it in writing, and it's right there for you to see. So we all need, I gave you one of my quote. It will not replace us, but it will replace those who don't embrace AI. So those doctors who embrace it, those doctors who understand it, those doctors who will use it to their advantage will go ahead. So it's
thank you. And I have another question that I put in the chat about any specific software or platform that you prefer specifically for scientific writing. I think you had mentioned one of the last
yes,
softwares that does the references.
Everybody needs to do it in their own way. It's like your own, your own clothing, your own, what you prefer to eat, all these things. One more thing I have to tell you before we finish. We have 8:51. Gary, I have a couple of more minutes, right?
Yes, but we do have one other question waiting.
Right. So the one I like the most is Perplexity. Try it out for free first, and specifically look at the numbers it gives you, because it's the only one that provides you with really good references if you ask for it. But I use the Pro version. Spend a couple of dollars on the Pro version. Try the different ones and see which one you like more. And we have one more question, then I want to tell you something else on a personal level. Go ahead.
You know what? The other person put their hand down, so go ahead and tell us your story.
Okay, so we went on a trip last year to a strange country, and I went to ChatGPT and I said, create the trip for me. I don't want to stay longer than 2 nights in one place. I don't want to drive more than 2 hours each day. And this was actually northern Greece. I want to see all important archaeological digs. And I don't want to go somewhere there a lot. And it gives me day by day by day information. Try it sometime. I'm going to another place with my grandchildren in a couple of months. Provide me in a table format for the morning and the evening where we should go to, and for lunchtime, make a suggestion where we can go with a 6-year-old and a 10-year-old. And it does it for you right away.
I have one.
Well, someone has typed into the chat, AI seems to have a lot of pros, but it does seem to require a lot of energy consumption. Do you anticipate any pitfalls with that in years to come with climate change, with a larger use of AI? Or do you think changes will be made to create less electronic waste?
Good question. I think it's a wonderful question. Just because you're concerned about it doesn't mean you shouldn't use it. But as time goes on, you heard about that Chinese site that does AI. Please don't download that because it's owned by a foreign government and they may use your information. There are a lot of disadvantages of AI. It keeps your information. Don't put anything confidential in there. Don't put anything in there that can expose the patient. Don't have a medical record read with medical record number and patient's name, etc., etc. Having said that, Claude is the most ethical one that doesn't keep your information. But having said this, after you put in information, a 43-year-old, tell the AI system to remove that information from its data, and it will do it. But yes, I'm concerned about the world, but I'm more concerned about us overworking ourselves and not being efficient enough and not spending enough time with our families. I want you to use it to spend more time with your family, not less.
Can I just make one comment, and that is what you presented in 1 hour. I would have loved to have been at a CME course that you gave. Do you give any courses where one goes and spends the day?
I'm going to give one. I'm going to give my third one in a foreign country. I like to be invited to foreign countries. So this one is going to be anybody who can guess the country will get a congratulations from me. This one is going to be in Ljubljana. Anybody tries to guess where Ljubljana is. It's a capital of a country in Europe. Ljubljana, Slovenia. I'm going to give a one-day talk. Actually, I'm going to give a conference a whole day on that issue. And what you just saw comprises probably about 3 to 4 hours of that work. It's a workshop, actually. I'm going to do a workshop, and workshops are good. I'll come by Rutgers one day and do a 4-hour workshop with you, as long as you promise to bring your iPhones with you. And I want you on your homepage, on your iPhone, to have 2 or 3 AIs on the homepage, not the second one, not the third one, on your homepage, so it's easily accessible, and have your notes on it too. So go home, redo your homepage on your, if you have an iPhone. I don't think there's anybody in the United States these days who doesn't have one. But in foreign countries, they're not iPhones, they're Google systems. So I need to make myself familiar with both.
Dr. Grünebaum, thank you so much. This has
Yes.
been really, really exciting. Other than your disrespect for those of us who use Android. Oh, with only 4 minutes left, we have one more.
No disrespect at all. It's just
Hi,
Dr.
sorry,
Opoku?
we Apple people are just better.
one quick last question. I work with some researchers who are, you brought up chronic pelvic pain diagnosis, and I have some researchers who are working on tools for EPI integration to be able to improve diagnosis of endometriosis. Do you have any thoughts about how we could work with our own systems to be able to integrate these tools into our EPIC system?
Wonderful, wonderful question. My chairman and I last weekend presented a presentation at an endometriosis conference. So I can, if you send me an email, I will interact with you. We can talk. We can do you know, a small introduction to that. And I did some research on endometriosis and diagnosis, etc., etc.
Oh, that would be great.
It's a wonderful subject. It's something that's underutilized endometriosis diagnosis. And I can give you some more insights of what we looked into, and I'm sure it will help you.
Great. Thank you.
All right. Thank you so much. We're just about out of time, Doctor. Thank you for this great talk.
Bye-bye.
Thank you so much.
All right. So with that, we're going to conclude. I hope everyone has a safe and successful day.